Happy 2022. Welcome to this year's first episode of Nashville General Hospital's Wellness Wednesday Facebook Live program. Thank you for joining us today. I'm Kathy Poole.
And I'm Kaylin Harris. Our goal of Wellness Wednesday is to introduce you to Nashville General Hospital experts, have them share information vital to your health and wellness, and give you the opportunity to ask questions during their presentation. Today is National Pharmacist Day, so joining us this afternoon is Beauman Dick, Pharmacy Manager at Nashville General Hospital.
Bowman received an Associate of Science degree at Andrew College and his Doctorate of Pharmacy from the University of Georgia College of Pharmacy. He is a clinical pharmacist with strong technology, process implementation, and servant leadership skills. Prior to joining Nashville General Hospital, Bowman was Director of Pharmacy for Cura Health Hospital and had roles as Pharmacist in Charge, Pharmacy Manager at multiple long-term care and community pharmacies in Middle Tennessee, including Terrene Farm Medco, NewScript RX, Reeves Sane Pharmacy, and Walgreens. Everyone, please welcome Bowman.
Thank you, Kathy, and thank you, Kaylin. It's a pleasure to be here with you today. Let me share my screen. Let's see. It's a pleasure to talk to you and to visit with you a bit about my role as a pharmacist here at Nashville General Hospital. I've had the pleasure of being a pharmacist for about 16 years now, and have had a variety of roles that have allowed me to interact with patients and to care for them as a pharmacist. I'm thankful to get to share some of that with you. Let's see. There we go. Pharmacists are, in a nutshell, medication experts. I feel like that is an oversimplification, but as the public knows us, we are that profession, specifically in medicine, that knows about how to take your medications, but not just how to take them, but how to make the most of the medication that you take. We're a part of the team that ensures that patients improve their health and find wellness through the use of their medications. We have a variety of experience through our 4 years of pharmacy school and clinical rounds, and some of us go through residency programs and training to be fine-tuned to be able to help patients get the most out of their medication regimens. I'll be remiss to say that we are assisted by pharmacy technicians. We have here at National General Hospital, we have a fantastic team of both pharmacists and technicians, and we could not get our job done without the valuable help our technicians provide to us. Here at Nashville General, we have two main areas of pharmacy where we can take care of patients. We have our community pharmacy. This is kind of the front-facing pharmacy that a lot of our patients out in the community where they get to come in and get pharmacy care directly face-to-face with a pharmacist. We've been in operation for a while now, but a fantastic team down there with Jeff, Camille, and Donna. And I'll get into that in a second. The inpatient pharmacy is one that's up here on the 10th floor. We have, again, a great team of inpatient pharmacists, technicians, clinical pharmacists, and pharmacy informaticists that are working together in a broad area of ways to be able to make sure patients their medication regimens are helping them improve their health in a maximum way. Now, our community pharmacy dispenses prescriptions to the public, and not just those who receive care here at Nashville General Hospital. Other patients, if you get care from at other clinics, can have your prescriptions filled here at Nashville General. The focus here is on people directly, and most of you have experienced that through your getting prescriptions filled at your local neighborhood pharmacy. One of the things that really attracted me to pharmacy was the ability to have that very direct, easy interaction with patients. Pharmacists have traditionally been one of the most trusted healthcare professionals in the country, and certainly one of the most accessible ones. And patients frequently come up and ask questions about OTC regimens, about their medication regimens, about just how to get access to their medications, be it a generic alternative or something that makes it more affordable to them. Patients count on us to be able to take their medication so that they can get well, essentially. But it's not just dispensing. A lot of other pharmacies also provide immunizations, that provide compounding services, which is where we customize medications, and medication therapy management, where we can have, instead of the usual more quick interactions with patients, we're able to sit down with patients and go through each of their medications, help them understand why they're taking them, maybe understand if there's some challenges to taking them, communicate back with their physician if we feel like there's other ways that we can make them change medications, and something that's going to have less side effects, or something that's not going to interact with another medication. But that's something that we can provide there, medication therapy management services here at National General Hospital. Inpatient pharmacy services. So this is the side of the pharmacy that maybe unless you're an inpatient here in the hospital, you don't really get to see much of. We provide medications in a very simple terms. We provide medications to patients who are receiving care in the hospital. And that's anywhere from the emergency room to patients all the way in the ICU, our med-surg floors, our operating rooms. Any medication that's dispensed here in the hospital comes through pharmacy, and not just from a logistic standpoint where we're putting medications in the hands of nurses and physicians, but it's a huge and vastly more important job is also making sure that those medications are being used appropriately, that medications are being given at the right time intervals, that they're being given in the correct manner, the correct route, to making sure that they're getting the right dose that is going to be optimal for if they can or can't take tablets, or if they need IVs. Yeah, it's our job as pharmacy to make sure that what the physician says they need medication-wise, that we're able to provide that in some manner, but then provide feedback to those physicians and say, okay, well, maybe we need to change this to that, or we need to adjust a dose because of their kidney function or something like that. They really count on us to make sure that their medication regimen is optimal. Specifically, we have a clinical pharmacy service. So in an inpatient hospital, there's usually two different sets of pharmacists who care for patients. We have a set of pharmacists who work in the inpatient pharmacy itself. It's more of a traditional role, I should say, where we're helping dispense medications, we're mixing IVs, we're reviewing medication regimens, and making sure that patients and that the nurses and the physicians who are taking care of patients have access to those medications, the right medications. We also have pharmacists who actually work on the floors and are rounding with our physician teams who are interacting directly with patients. Most of our pharmacists do this. We have a few that are dedicated just to this role, but they take care of everything from the very time you walk into the hospital, with reconciling your medications, looking over what medications you've been taking with at your other pharmacies and the outpatient, reviewing those, making sure that we're continuing the ones that they're important that you need to be continuing on, reviewing those if perhaps you're in the hospital because of something that's with your medications, or something that because you're in the hospital you need to be off certain ones until you're well enough to be back on those again. We review those from the very beginning, and then the whole time that you're here, reviewing that regimen, giving feedback to the providers here to making sure that your regimen's optimal, and then before you leave, doing counseling with you, making sure you understand the medications that you're taking. And a lot of times patients are discharged from here on new regimens, new insulin, new blood thinners, other medications that require education to make sure the patient understands why they're taking it, making sure that they understand the importance of it, and how to look for side effects, and how to and who to contact if they do have any side effects. We also have pharmacists here that provide information. So informaticists, it's kind of a big word, but these pharmacists help look at the data. Hospitals, it's astounding how much data we consume and how much we need here on a daily, on a minute-by-minute basis. Pharmacy and informaticists help make sure that all the data that we have access to, from the patient's medical record to drug information that we use to help understand how to for reference materials. We have that, all of that kind of comes together in the right way to provide optimal patient care. And that's about the end of my presentation. Let me go back. I'm sorry, stop sharing.
Well,
thank y'all for letting me share that.
Oh, thank you for sharing today. We really appreciate all the information that you shared on pharmacy, the breakdown of how Nashville General Hospital pharmacists, what you all do, and the different disciplines and the different avenues that someone can take if they are interested in pharmacy. Because I think a lot of times we think about the person who is not prescribing us medication, but the person who's giving us medication from behind the counter. And there's many different avenues that someone can go into. So thank you.
Absolutely.
I am monitoring the chat. So if anyone out there on Facebook Live has any questions for us today, or for Bowman, I should say, please make sure you ask in our chat, but I will look and see now.
While Kaylin's looking, there's a Netflix show or Hulu, one of those streaming services, on Dope Sick, and it talks about OxyContin and how it was marketed to pharmacists. So, it's kind of scary just even watching that. What changes have you seen in your 16 years of how pharmacists or drug companies can actually kind of market to doctors? And then are they just marketing to the doctors, or do the pharmacists get pulled in too? I mean,
that's a great question. When I first started practicing, OxyContin was already a fairly big medication. I remember actually learning about pharmacy in pharmacy school, about pseudo addiction, and about which is basically where a patient may experience symptoms of needing a medication when they really are not. Basically, it's an addiction-like behavior, which interestingly in that show and in other shows I've seen on Netflix, they've come back and said, well, these, what we learned about and what we were in the presentations that we received on things like that were part of the drug marketing. It was fascinating when kind of all that was put together. When I first started out, also there was a lot less emphasis on pharmacists, how much access we had to patients and what they were really experiencing on the front line. I remember patients would come in with prescriptions that were clearly way more than what they should have been receiving, or from you hear about these places that would basically hand out prescriptions in Florida, and they travel across state lines and bring them to you. And at first there was a lot of pushback on, well, pharmacists, you're just there to dispense a medication. But it really became with a lot of push from like the Tennessee Pharmacy Association, from national pharmacy organizations, where they realize that pharmacists really are providing a service, and that we are, what we're seeing on the front line is real, that these patients really are becoming addicted to these medications. And it's really sad, some of the things that I've seen in my years. And fortunately, that has dramatically changed. Physicians far better understand addiction, and far better understand how to dose medications to make sure that patients are getting just what they need, because patients do need pain relief. I've seen some patients, veterans that are have come back with horrible wounds that it just the amount of pain they're in, I just can't even imagine the sacrifice they've made and the pain that they're going through. So that's a real thing, but helping understand and how much pain they're in and how to better control that without just giving them medications and pushing them into addiction I think we do a fantastic job of that. And I think here in National General Hospital specifically, we have an opioid stewardship committee that is specifically dedicated to making sure that patients receive the right amount of pain medication, that we're looking for alternatives to opioids. That's a big one. And Jacob Wetzel, one of our pharmacists, heads that. And we've done a great job over the past couple of years since he started that, and writing order sets and trying to get physicians into writing things that are going to lessen the concern of addiction while also managing patients' pain.
Oh, that is perfect.
Yeah.
And we actually do have a question that has come through in the chat.
All right.
So what questions should a person ask their pharmacist when they get a new prescription?
That's a great question. So the first question is to ask, why am I taking this medication? There are far too many patients that I've seen that take a medication and have zero clue why they're taking it. You as a patient need to understand that. You are, while we rely upon physicians and nurses and pharmacists to help us in our healthcare, you're the captain of your own healthcare. You're the one who can turn this one way or the other. And so the first question you should ask is, why am I taking this? The second question is how I should take this. It's not just on the pill bottle, it's going to say take it twice a day. Should you take it with or without food? Should you take it with regardless of other medications or OTCs? That's a big one, because some medications you get have got a couple different medications in them that one may be OTC that you want to make sure you don't double up on those.
What's OTC?
I'm sorry, over-the-counter medication. So anything that you can buy at a drugstore that doesn't require a prescription, your Tylenols and your Robitussins, that sort of thing. And so you want to make sure that what you have, and not just over-the-counter medications, but herbals. There's lots of different things you can take. They can interact with your medication. So asking about how you should take it, and letting the pharmacist know of other things that you take that wouldn't be known to them, that aren't on a prescription. But then your final thing should be to ask what side effects. Every medication will have side effects. I wish they would come out with ones that had zero side effects, but that's just not how our body works. And so you're going to experience some, mostly minor side effects, but understanding what those are and to be on the lookout for those, so that when they happen, you understand how your body's working.
Thank you, Bowman. Okay,
Absolutely.
You are popular. We have a bunch more questions in the chat. So one of the questions, or the next question is, do you recommend water or caffeine when consuming medications, and why? And this person also just humbly stated, I may take my blood pressure medicine with coffee and want to make sure it's okay.
Well, limiting caffeine intake when you have high blood pressure is definitely a good idea. Increased caffeine intake can cause increased blood pressure and heart rate. And so, limiting your caffeine intake. Now, what you take it with specifically to make sure you're taking it correctly is, water is always a better option anyway. But I think that if you're taking, especially blood pressure medication, or you're taking medications for reflux, for indigestion, coffee can irritate that as well. So I definitely recommend water. I mean, be honest with you, most of us, myself included, don't drink enough water every day anyway. I've heard as many as 8 glasses a day, but you certainly should need to be drinking more water every day.
And thank you. And then the next question is, if a patient is taking multiple medications, how do they ensure the medications do not interact with each other?
So that is where you would sit down with your pharmacist and ask them. You show them your list of medications. I can't tell you how many different times a patient has brought in their notebook piece of paper with their written out list of medications and the things that they take. And sometimes I have to kind of do some interpreting there of what they're actually taking. But that's a very common thing for us pharmacists to do, something we enjoy doing with our patients. Keep a complete list. That includes things that you wouldn't necessarily take on a scheduled basis. If you take, Tylenol, or if you take ibuprofen or something else for your pain whenever you're in a little bit of pain or have a headache, including that on your list, so that the pharmacist can look and make sure that what you're taking is not causing another medication to work as well or to work better than it should, and that you experience a fewer number of side effects.
Thank you. I'm still monitoring the chat, so if anyone else has any questions for Bowman, we will definitely answer live.
I remember when I would take my mother to a lot of her doctor's appointments, that was the one thing we had to make sure she had. It was a typed list of every single medication she was on, because we were going to her cardiologist, we were going to her hematologist, and we, up in to see the gastroenterologist. And it was just, in being able to update it and keep it updated was kind of difficult when you have, those of us who have aging parents, and you're kind of in that sandwich generation. You have kids and you have parents you're trying to take care of, making sure you already know what you take in your kids, but then also ensuring you have that information on your parents as well.
Absolutely. And going to one pharmacy for all of your pharmacy needs really helps with that. Even in this information age, a lot of pharmacies are, unless you're going to like a one chain like Walgreens or something, they're not going to have all the information in one place. So keeping up with that information yourself in a hard copy, or if you're savvy with a smartphone and can keep a list on there. I know I keep lots of lists on my smartphone. Someplace but you have to be the one that's responsible for that, and you have to be the one to keep up with that, because the chances are highly unlikely that one place will have all that information automatically.
Well, I think that is all the time that we have today. But first and foremost, thank you so much, Bowman, for coming on and speaking with us for National Pharmacist Day. We really appreciate you taking the time out. And for anyone who is watching, if you have any additional questions for Bowman, please continue to comment below, or feel free to send Nashville General Hospital a message on Facebook. And then, as a reminder, Bowman did a great job of speaking on the community pharmacy here at Nashville General Hospital. It's available to all of our patients, visitors, and staff members. It's definitely worth a look. For more information, you can also visit our website at nashvillegeneral.org.
And thank you again for joining us today, Bowman. I have to give a shout out to the Georgia Bulldogs. Congratulations this week. Mark your calendars for our next Wellness Wednesday event. It will be on Wednesday, January 26th at 12:15. January is Cervical Cancer Awareness Month, and we will be joined by our own minimally invasive GYN specialist, Dr. Nathaniel Klein.
All right.
Have a great day, everyone.
Thank you. Take care.